All right, welcome to lesson 5 of concepts of medical records. So, in these lessons, we are talking about creations and development of the medical records. Okay, so we want to find out who creates the medical records and what processes does the medical record go through uh, when you are developing. So those are the things that we shall be looking at. Who creates the medical records, and then the processes involves in the development of health records. So now you may need to ask yourself, or we're gonna ask ourselves, uh, who creates medical records? Hmm? Who creates medical records? All right. So the creations of the medical records involves different people within the professions of health practice. So we have, for example, we have the doctors. They are also the teams that creates the medical records. We have the physicians, the like of the clinical officers. Okay, they are also responsible, or they are creators of the medical record as well. And then we have the nurses. They are also creators of the medical records, and other healthcare professionals that write up the medical records. So, like we said in the previous discussion, that the medical record is a kind of a records which is created by different people. I mean, different health individuals, professionals within the health facilities. So therefore, it means a record will not consist with only handwriting of a person's. Different people who have seen the patients will be responsible in creating a record, because every time anybody sees a patient and discuss anything, or maybe provides a service to a patient, these services must be recorded down. So this will contribute to the creations of the medical records. Okay, so when does the healthcare professionals write up health records of our patients? And therefore, the previous medical information is made available when, for example, a patient returns back to the facility. Okay, so creations of the health records start with uh, outpatient case. Okay, it starts with the outpatient case, or outpatient's uh, records, or outpatient department. So what happened at the outpatient case? Hmm? A medical records originates at the outpatient department counter by the registration and insurance of the outpatient ticket. So with the outpatient ticket, a patient goes to the medical doctor in the OPD clinics for consultation. So when a patient comes to the facility, the first thing that will happen would be the registrations of the patients into what we are referring. I've used the term ticket, outpatient ticket, but it may be outpatients patient's medical book. We have a situation, not a situation, but we have a states required by everyone to buy new books whenever they are going to the facility. Or maybe you must have a book at least somewhere for your information to be written in. So that is required by the facility for every patient to have such. So when you are done with the registrations of the patient's name, for example, the identification data at outpatients, uh, the patients will now proceed to go and see outpatient, I mean a doctor who is situated in the outpatient clinics for consultations. So the consultation would consist of asking questions of the previous illness of the patients, and what is wrong with the patients. It will be like, why are you here? What's the problem? So the patient will be talking about the kind of problems that they're experiencing, the signs and symptoms that they may be a position to explain. And of course, as the patients are talking, the doctor is writing. Okay, so if some other complaints of the patient require examination, it may be physical examination. All right, everything will be done in a clinical room of the outpatients, and the doctor will always record those information right down into the patient's book. So when as those are happening, it simply means that the creations of the medical records is progressing. Okay, it is progressing right from the registrations. It comes to the clinical outpatient clinics where the outpatient doctor or a doctor right there in that clinic is now progressing with the registrations of the informations and whatever things that they are carrying out to the patients. Previously, we talked about different types of the health record forms or hospital form, and of course, we found out that we have one of the form called progress notes. We have one of the form called treatment notes, okay, which is used mainly for the recording of the previous, I mean, the continuous assessment of the patients by doctors is recorded into that medical forms, and every complaint of the patient is collected into that piece of the form. So doctors, after examination and notes, the provisional diagnosis or whatever they discover, they will record them. If at all, some of the patient's complaint will be enough in provisions of diagnosis and also treatment, then doctors would be able to proceed and prescribe medicines and advise and also send the patient home. Okay, so when a patient come with a minor problems that then we're talking about, let's say a patient says I fever, I'm sweating in the night, there's body weakness, there is the joint weakness and something like that. So the sign that the patient is seeing may be very obvious to the problem. And of course, the doctor will now do some other investigations like carrying out physical examinations. So they may come out and say, you know what, the problem is that you have acute malaria or you have chronic malaria, because we can see that even your eyes has changed and everything, and the pressure is very high. The temperature is very high and something like that. So such kind of complaint will definitely give doctors answers as a provisional diagnosis, and therefore they can be able to prescribe for you treatments and advise you, and definitely the patients can leave home. So that is from the outpatients. So after that, the records clerk in the OPD department enters the patient name, age, the outpatient number, provisional diagnosis, prescriptions into the outpatient register. Okay, so when a doctor is really done with everything, a patient will now come to the medical records department before going home. Okay, before even getting drugs. All right. So after that, you will have to get a book and copy everything that the doctor has written down, even including the information you have collected at the beginning of the registrations. You copy them into the register, and then you assign a number to the patient into that book so that they can be allowed to get medications wherever types of treatment they have been prescribed with. That to give the dispensing or the pharmacy guides. So you must issue a number right there. But most importantly, you will have to make sure that you record these informations into the register before this patient can leave the hospital. Okay, all right. So then we have another stage called inpatient case, or maybe inpatient records. Inpatient records. So if a patient needs treatment as inpatient, the doctor shall give a direction to admit the patient in the front sheet or in identification and summary sheet. And patients or relatives shall report to the inpatient counter with the records for further registrations. So at the inpatient counter, patient details like the names, the address, the sex, the age, the sex, the occupations, income, dates and times of admission, etc., including the date of birth, will be entered into the admission register and case records. So the ward and unit of admission also entered in the case records. Inpatients medical records of those patients admitted to the hospital should be attached with case records. Okay, so for example, when a patient come, because we have patients that may come to the facility under critical condition. Let me talk about the patient that come to the facility under critical conditions. Okay, so when a patient come and to the facility and the patient is conscious, for example, probably means that the first thing that the facility need to do is first of all to rush the patient to start giving the patients a first aid and other services. Okay, so that means they're not looking at registration as a priority. But then in this case, as a patient goes in for treatment, the persons who has accompanied the patients should come to the encounter, to the counter or the admission uh, table, and then give the details of the patient and register the patient for admissions. Meanwhile, the doctors are trying to carry out resuscitation process if it is any kind of unconsciousness and the rest. So then now we have a patient that can be admitted and can come for to the facility, and but they are not badly off. So when they come, then after some examination, doctors confirm that, you know what, we are supposed to admit you because your condition is actually is going to worsen if we don't do that. So in that case, those patients that comes when they are really not in a bad conditions, they first start with the registrations. So after the registrations, then they can be able to proceed with the other procedures of the treatment. Okay, so those are strictly for neo patients. And then we have issues of readmissions, okay, or reattendance. Someone may be admitted today and been discharged after 5 days. Then after that, the situation again come back. You find a patient has come back to the facility. So that one we consider them as a readmission, is being admitted not for the first time, or maybe for second time, third, or whatever it is. So as long as it's not the first time, that is considered as reattendance or readmissions. So in cases of reattendance or readmission, the individual patient's medical record must therefore be readily available. Okay, so this is now the point that we see that recording the information at the first place is very important, because when a patient comes back to the facility for readmissions, it may be for the same problem, or maybe there is a different problem, of course, but the previous records must be available. Okay, so the jobs of ensuring that the records are available, the records of the patients, the previous records are available, the jobs is for the medical records assistant. Okay, you must make sure that you retrieve these records and then you provide them, and then you retrieve them and bring them. And of course, the doctors will continue developing these records by continue writing whatever situation that the patient is again is experiencing. So the development of the medical records will now keep on continuing like that, as far as the patient keep receiving services from that facility. Okay, so as at the end of the day, when a patient is being discharged, all right, you follow the same procedure that you did before. Then you issue the record number to the health records, and then you can be able to file them somewhere. Because why am I saying you should file them somewhere? Because tomorrow when this patient come back again for readmission, you will be in need of that records. And if you don't file them, that means tomorrow you will not be able to get them where you kept them to. Because you cannot just maybe when everything is done, then you go and dump it just anywhere. Because tomorrow, readily accessibility of that records will amount or will regard as important aspect within a medical records department. All right, so let's talk about development of records. So now you can be able to even give yourself a questions: where does development of the medical records begin from? Okay, where does the development of medical records begin from? All right, okay. The medical records begins with the patient first admissions as an inpatient, or attendance, or an outpatient. So if I combine medical records to the healthcare facility, okay. So the medical records begin from admissions. In summary, the medical records begin from admission, okay, to and ends at discharge, okay. So the developments of the medical records begins, you can actually be able to summarize this somewhere. the development of the medical records begins from the admission counter and ends at discharge. Okay, when we receive a patient, as soon as the patient come in contact with any member of the facility, the development of the medical records begins from there, right? Then where will it end? It will end the day the patients will be discharged. Are we together? So now this will also give us a questions like what is admission and what is discharge? What's the difference between the two? Okay, you can write it somewhere. Admission is a formal process where a patient is accepted in a facility for hospital care. So when a patient is accepted for hospital care, the purpose is hospital care because we really do admissions in every day. Even you listening to me right now, you actually admitting. You're admitting. So, but what is the purpose? That's the problem, okay? Or that's the questions. So why do we admit? Because you can even accept someone in your house, by the way, in your house. All right, you can accept to accommodate somebody. That is admission. As long as you give someone your time, attentions. All right, it is admissions. But what's the purpose of that? So now we define admissions as a formal procedure or process of accepting a person in a facility for the purpose of hospital care or treatment. Right? Then discharge is a formal procedure or process where a person leave the hospital at the end of treatment or care, into bracket episodes or event. Right? So when we receive a patient at the facility for the purpose of care, we will be managing the conditions of the patients for as long as the condition persists or the treatment respond to the treatment respond to the conditions. So when the patient is now fine, completely fine, all right, then that is when we can now formally says that you can be able to leave the facility now and go home. Okay, it must be in a formal procedures. All right, but patients when discharged, they are only not discharged to home because in most cases the status of the discharge will also matters. Why are we discharging you? It is because you have recovered fully, or we are discharging you because we cannot manage your condition here. So we are discharging you and referring you at the same time to another facility where they have better services than here. Okay, it may be we don't have machines to do the screening and the rest. So we are suggesting of transferring you to another facility. So that is a different thing. Okay, but however, as long as the patient leave the facility at the end of the service, that is discharge. So it can either be a patient being discharged home, can either be a patient died. Because even when a patient died, it should be discharged, okay, formally. All right, so that is the differences. Okay, so when a patient has come to the facility, the developments of the medical records starts immediately at admissions. As soon as the patient come in contact with any member of the facility, the developments of the medical records commence immediately. All right, so this will begin with the collections of identification informations, okay, like the names, the sex, the address, the next of kin, the date of birth, etc., which is recorded on the front sheet or identification and summary sheet. All right, so like I said before, front sheet is the first form in a medical records. So it must be in the front of every forms, and that's why even the name implies front sheet. Okay, so when the information is collected, the names of the first form in a medical records varies from hospital to hospital and country to country. So definitely you may go to some other facility and you find they are really not calling the first form front sheet. They are calling them identification and summary sheet. They're calling them admission form, right? So of course, like we even discussed in the designing of in a form design, etc. It will now based on the purpose at which the form is being designed, and then the interests of the people, the personnel that are going to use the form. Okay, so the development of the medical record usually starts at the registration counter, okay, or unit of ward reception of the clinic, the admission office of the hospital, or even emergency room office. The first time a patient presents or is brought in for care or treatment, or a patient is seen for the first time, the development of the medical records begins immediately. Okay, so um, the collections of essential and accurate identification information is the first step in the development of the medical records. So the essential information that is collected at the point of the patients coming in contact with any member of the facility, and then they begin to collect information, identification information. This essential information will include the following. Okay, number one, will includes full name, family name, given and middle name, even including initial name, the health records or hospital file number. The hospital file number is not that you don't collect it from a patient. You cannot ask a patient that, please, what is your health record number or hospital file number? No, they don't know. And when a patient is coming as a new patient, they don't have. Okay, even if they're coming for the second time, they don't know or they cannot remember. All right, so it is you who are supposed to find out whether this patient is having a number or you need to get a number for that patient. All right, the procedures of doing that is in record identification and filing. Probably maybe you are going to talk about it in the next semester. Okay, then we'll also collect the date of birth. This is very important because the date of birth sometimes helps us in filing. Okay, it will help you in filing. Sometimes you rely on the date of birth for some reasons that we are going to talk about them. And then we also need the date of birth in order to determine the weight, and also, I mean, not the weight, but the age of the patients. Okay, so somebody may not be able to know the age, but if you know the date, then probably we can be able to get the actual what date of birth. Then we have the address. Where is the patient coming from? This is very important because sometimes we may need to make a follow-up, or maybe a patient does not have any person, then we may need to know where the patient is coming from. It is for the population concerns and also the general use of the health information system. Okay. Then the next thing is gender. Is it a patient male or female? Gender or sex? Why are we asking for the sex or the gender of our patients? All right. The types of the services that is offered at the facility, as far as the medical services is concerned, the both sex don't receive the same services at the same time. For example, if we have a male person who is suffering from malaria, then we have a female person who is suffering from malaria. If all of their signs and symptoms indicate they're having malaria, a male person, you can go ahead and prescribes and give provisional diagnosis straight away. But for the female person, you may need to carry more further investigation. For example, try to find out whether this patient who is a female is not pregnant. All right, so that it will determine the which types of the malaria treatment you will give is very important. All right. So if a patient is being admitted to hospital, the provisional or admitting diagnosis must also be included at the times as the reasons behind the patient's admission for care or treatment. All right. So as soon as the patient comes to the facility, the reasons why you are admitting a patient is also it must be recorded, and that is what we call provisional diagnosis or admitting diagnosis. A patient may come to the facility with a certain complaint as reasons why they should be admitted, and or maybe you have confirmed reasons. For example, we may have like someone is coming and the primary problem is threatening abortions, or maybe it is preterm labor, all kind of that. Okay, then you must be able to indicate that. Right? So if a patient is being admitted, that is the kind of thing that must be recorded. right? So the patient is then sent with the developed medical record to the clinic or to the emergency room or whichever they are supposed to go and meet their medical doctor right there. Okay. The next things that may happen is in the inpatients or emergency clinic, right? So in the emergency clinic, the nurses and doctors records information collected at this time onto the forms provided, remembering always to write the names and the hospital file number on the top of every new forms used. So the person who provides the service should sign each entry. All right. So there are things that you need to understand from here. One is that before the patient goes to that department, that patient should be having a health record number. Okay, the patient should be having the names, all the details, the essentials identification details, so that whenever the doctors uses any new forms, they will copy the same details that you have recorded in the first form into every new forms they will be using. Okay, that will indicate that those forms belongs to one patient and they are supposed to be filed in one folder. Okay, so on a daily basis, the doctor continues to record or write notes on the patient's progress, medical findings, treatments, including prescriptions for medication, test results, and general conditions of the patients pertaining uh, pertaining past medical history, family medical history, history of the present illness, uh, physical examination, plan for treatment, request for laboratory or X-ray tests, etc. So if at all things is done, the doctor will be able to record all of them down. Okay. As the patient continues staying in the facility, many things will be done. Okay, X-ray test may be done, blood screening may be done. All those things will be recorded, will be continuously recorded into the progress notes. Okay, then now when all of that is done, we shall now finalize at the last stage of discharge. So when the patient is discharged, the doctor records at the end of the progress notes the condition of the patient at discharge, the prognosis, the statement, treatment, and whether the patient has to return for follow-up. In addition, the doctor should also write a discharge summary and write on the front sheet of our records the principal diagnosis, other diagnoses, operative procedures performed, and sign the front sheet to indicate the responsibility for the information recorded under his or her signature. So that is at the stage of the discharge. We expect the doctor to record down what has been happening, whether the patients, the types of the treatment which has been given to the patients, and how the condition of the patients at the discharge compared to when the patient was coming. And then at the end of the day, they must be able to sign under that discharge notes showing that they are aware or maybe the information provided is under their responsibility. Okay. All right. So we want to talk about uh, medical records documentation and instruction. Okay, as a new topic within lesson 5, medical records documentation and instruction. So what is documentation and why is it important? What is documentation and why is it important? So when we talk about documentation, just like when as we were concluding this discharge, we said that the doctor must sign, okay, every forms to give the responsibility for the information provided. So that is documentation. Okay, if you find any piece of information bearing a stamp signature, it's a document, isn't it? As it means it has been documented. Okay, so that is just as simple as that. Signing of the document, putting the stamp where necessary, including the names of the service provider where necessary, that is documentation. So the bigger question is why documentation is important. Number one, uh, The medical records documentation facilitates medical records documentation is required to record pertinent facts. The pertinent fact is it means the life pertaining information or integral part of the patient's life. The pertinent facts are like of the diagnosis, the lab test results, because they talk about the reality of the health test of the patient, the findings, what have they found out that is your problem, okay, and observations about a veteran health history, including past and present illness, examination, test, treatment, and outcomes of treatment. So all those things is facilitated through documentations. Number two, the medical records document the care of the patient and is an important element contributing to high quality care. Okay, so if the records is documented, and if the medical record is always available, that means that is the only way the high quality services can be ensured or be assured. Okay, three, inappropriately documented medical records can reduce many of the hassles associated with the claims processing. So what are we looking at? You see, if there is no medical record, for example, and in case anything happened, there will be no way that you could say that I was given such a drug, and that is why I experienced high abortion, for example. But you will confidently say that and actually take actions, legal actions, because you are basing on the evidence that you believe you have. And where are those evidence found? Those evidence are actually found in your medical records. So if if the claims is not correct, all the clarification and justifications will be made basing on the available records, because the record will indicate what's actually been done or the fact that has been provided as services to the patients under that individual care. Number four, medical records may serve as legal document to verify the care provided. In addition, I have explained that with point number three. So you will use these informations as a medical record. These medical records as a legal documents. Okay, that you can go with it in a court of law to claim for whatever it is. Okay, and it will be legally accepted. Number five, the ability of the physicians and other health care professionals to evaluate and plan a different immediate treatment and to monitor his or her health care over time. So probably the clinician, the medical doctor, the specialist, whoever who are concerned with the patient's care, they need these records in order to understand what treatments have we administered so far and what is the condition of the patients. Is the patient responding to treatment? Does the treatment we are giving to the patients really working? So they will definitely plays a big role in the monitoring of and planning for the immediate treatments of the patients and continuously monitoring the health of the patients under the hospital care. So number six, the documentations also serve in communications and continuity of patients' care among physicians and other healthcare professionals involved in the patient's care. We talked about the importance of all the reasons or purposes of the medical records, and communications was one of them. All right. So when documentation has been made in our medical records, probably the doctor who has not been there or not been around or present is able to understand what happens in their absence, and then they will really be able to determine from where they should begin new services from, or from where to continue from. That's very important. Next, um, accurate and timely claims review and payments. All right, when you have your records, things can be done in time. Whatever you may think of claiming, whether payment from the insurance company, whatever it is. Number eight, appropriate utilization, review, and quality of care evaluations. We use the medical records which are documented to evaluate the standards of the care being rendered to patients. Number 9, collections of data that may be useful for research and education. Okay, so we basically have the concepts of medical record documentations. Okay, what does the medical records document? Hmm? What does the medical record document? So the documentation of care given to patients during their stay in the hospital is an essential part of the provisions of that care. So if you provide the service and you do not write it down, that means you're really trying making something wrong. So every service is provided, it must be recorded, and that will be very important as part of the provisions of that service. So what tools will you use in the documentation process of the structured medical records? Okay, so the tools that you would need is a medical records. Okay, so the tools used for this documentation is the patient's medical records, hmm, which is structured. A medical record which is structured, it means it has a good layout, it is summarized, it is understandable, it consists of the language that the reader or the user understands. So those are the things that will determine the quality of the service provided and a certain facility. So the concepts of medical record documentation involves 5WSH features. Okay. The concept of the documentations involves 5WSH. And what does the 5WH SH stand for? That means you will have 5 Ws. The first one stands for where, which refers to where the patient has gone for medical assistance or medical service. The next W is who creates the medical records of that patient and that care. The third W is when, refers to the date and time a patient starts utilizing the health facility resources. Okay, that one is determined from the dates and times of admission. Next W, that is why. So that why stands for the reasons behind a patient visit to the health facility or institution. So this one will be the like of diagnosis. Okay, why did you come to our facility? Because they had this problem, malaria, hypertension, etc. Okay, then the next W, that is what. What happens after the visit? What happened after the visit, after being admitted, after being treated? So the results of the patient visit to the facility, whether the patient is discharged alive or the patient is discharged dead, okay, or it is transferred to another facility. So the 5WSH will look at that. Finally, H, that is how. Okay, how is the treatment, therapies, or service will be received? How will it be received? Okay, that's so now we have some when you are admitted, some treatment that will be given through IV, and some other treatment will be given to you through injections, tablets, etc. Okay, so that is that. All right, so in the next continuations, we shall talk about the factors influencing proper uh, documentations of medical records. That will happen in our next uh, lesson, the next meeting. Okay.